Temporary cardiac pacing is an intervention that helps the heartbeat get back to a normal pace and rate. It is commonly used in patients with symptomatic bradycardia, such as slow escape rhythms, conduction defects and heart blocks. It serves as a bridge to implantation of a permanent pacemaker. In temporary cardiac pacing, wires are inserted through the chest during heart surgery. This is what we call the epicardial wire. It can also be inserted into a large vein in the groin or in the neck going inside the heart, and we call this transvenous wire. These wires are connected to an external pacing box, which delivers a current to the heart to make it beat normally. A heartbeat occurs when a small electrical current is delivered to the heart muscle, causing it to contract. There are 4 chambers in the heart, 2 in the upper part, known as the atria, and 2 in the lower part, known as the ventricles. The sinoatrial node sets out an electrical impulse which travels to the muscles of the atria, causing them to contract. It also reaches the atrioventricular node, which stimulates it to send out another electrical impulse. This travels to the muscles of the ventricles, causing them to contract. When the muscles of the heart contract, the heart pumps out blood and you get a heartbeat. The normal adult heart beats in a regular rhythm at a rate of about 60 to 80 beats per minute. Proper contractions at a normal heart rate are essential for delivering oxygen and nutrients to your body's organs and tissues. There are 2 ways to insert temporary cardiac pacemaker. 1. Transvenous. It is inserted through a long narrow catheter with an electrode at the tip that is threaded into a large blood vessel, usually in the groin or neck, until it reaches the inside of the heart. This is done with the help of X-ray screening to see the exact position of the catheter. 2. Epicardial. It is done during heart surgery, where the exposed ends of insulated pacing wires are attached to the outside surface of the heart and then brought through the front of the chest. Temporary epicardial pacing is the method of stimulating the heart through the use of Teflon-coated unipolar, stainless steel wires that are inserted loosely to the epicardium after cardiac surgery. The epicardial wires may be attached to the right atrium for atrial pacing or to the right ventricle for ventricular pacing. It can also be attached to both the atria and ventricle for atrioventricular pacing. Indication for temporary pacemaker. Following a heart attack, acute myocardial infarction, following heart surgery, awaiting insertion of a permanent pacemaker, and to make the heartbeat faster to override an undesirable rhythm. Complications of temporary pacemaker. Bleeding at the insertion site, infection, bleeding if pacing wire has pierced the blood vessel or the heart wall, puncture and collapse of the lung if the wire is misdirected. Hiccoughing if the electrical impulse spreads from the heart to the diaphragm. It can cause the diaphragm to contract. You can give adequate analgesia and sedation. Injury to the grafts and ventricular dysrhythmias for the epicardial pacing, transmigration of temporary epicardial pacing wires. Management of epicardial pacing wires. To avoid microshocks, always wear gloves when handling pacing wires. It is necessary to keep the wires insulated by covering each one with gauze and sterile dressing. The sites must be checked daily for signs of infection, such as redness or purulent discharge. Nurse responsibility. checking the threshold parameters and assuring proper functioning. Basic operation. Turning on or turning off the temporary pacemaker. To turn on the temporary pacemaker, press and hold the on-off key momentarily. When the temporary pacemaker turns on, the following occurs: a self-test is initiated. When the self-test completes successfully, the temporary pacemaker first searches for cardiac activity during the first pacing cycle, and then begins sensing and pacing in both chambers, DDD pacing mode. The upper screen and the backlight illuminate. A self-test is initiated. The temporary pacemaker first searches for cardiac activity during the first pacing cycle, and then begins sensing and pacing in both chambers, DDD pacing mode. Warning: to prevent pacing into the vulnerable period of the T wave, turn on the temporary pacemaker and turn down A output and V output to the minimum amplitude before connecting the temporary pacemaker to the patient's lead system. Determine sensing thresholds before turning up A output and V output to threshold levels. To turn off the temporary pacemaker, do the following. 1. Unlock the temporary pacemaker if it is locked. 2. Press the on-off key once. A message is displayed in the lower screen to confirm temporary pacemaker shutdown. 3. Press the enter key once within 30 seconds to confirm temporary pacemaker shutdown. Note: if the enter key is not pressed, the temporary pacemaker remains on and continues to pace at the currently selected values.
This is the green light, which indicates pacing when flashing. This is the blue light, which indicates sensing when flashing. First, we'll review the basics of sensing. For the pacemaker to pace at the appropriate time, it needs to sense the patient's intrinsic rhythm adequately. Sensing is like a fence. The higher the number, the less sensitive. The lower the number, the more sensitive it is. When a fence is set low, more is seen on the other side of the fence. The higher the fence, the less is seen. This is true for sensing. With lower numbers, more will be seen. With higher numbers, less is sensed. Appropriate sensing results in every heartbeat being properly sensed. This means that when the lead or wire is located in the atrium, all P waves are sensed, and when the lead or wire is located in the ventricle, all R waves are sensed. It also means nothing extra is sensed, such as a T wave, which would be interpreted as a heartbeat.
Threshold values are needed to determine the appropriate settings for output and sensitivity. Note: to reduce the risk of competitive pacing, determine the sensing thresholds first, if the patient's intrinsic rhythm is adequate. The temporary pacemaker detects the heart's own beat and does not deliver a pacing stimulus. Sensing threshold. The sensing threshold is the least sensitive MV setting at which the temporary pacemaker can detect a heartbeat. Monitor the patient's ECG and blood pressure as you follow the procedure to determine the atrial and ventricular sensing thresholds. Determining atrial or ventricular sensing threshold. Only use this procedure on patients with adequate intrinsic rhythm. To determine atrial or ventricular sensing threshold, perform the following steps. 1. Turn on the temporary pacemaker without connecting it to the patient lead system. Caution: do not connect the temporary pacemaker to the patient lead system until step 4. 2. Set rate to at least 10 ppm under the patient's intrinsic rate. If necessary, continue to reduce the rate until the temporary pacemaker is not pacing the patient. 3. Adjust the atrial or ventricular output to prevent the risk of competitive pacing as follows. Atrial, set A output to 0.1 mA. Ventricular, set the output to 0.1 mA. Decrease rate, A output, and V output. 4. Connect the temporary pacemaker to the patient lead system. 5. Navigate to the mode selection menu and select the appropriate pacing mode for the patient leads that are connected to the patient. Select DDD pacing mode if both channels are connected. Select AAI pacing mode if only the atrial channel is connected. Select VVI pacing mode if only the ventricular channel is connected. 6. Navigate to the sensitivity settings. 7. Decrease sensitivity. Slowly turn the menu parameter dial counterclockwise. Increase MV value until the sense indicator stops flashing. The pace indicator flashes continuously, but capture is not likely because the output value is set to minimum. 8. Increase sensitivity. Slowly turn the menu parameter dial clockwise. Decrease MV value until the sense indicator starts flashing. The following occurs. The pace indicator stops flashing. This value is the sensing threshold. 9. Set sensitivity to half or less the threshold value. This setting provides at least a 2:1 safety margin. 10. Restore rate, A output, or V output to previous values. Note, determine the atrial or ventricular stimulation thresholds after determining sensing thresholds.
To perform the sensing threshold test, first turn on the temporary pacemaker without connecting it to the patient lead system. Ensure the patient is connected to an ECG you can monitor during the testing. When the temporary pacemaker is initially turned on, it will begin sensing and pacing in AAI or VVI mode with nominal values of a rate of 80 ppm, output of 10 milliamps, and sensitivity at 2 millivolts. In this example, we will determine the ventricular sensing threshold in a patient who has an underlying rhythm of 50 beats per minute. The temporary pacing lead or wires are in the ventricle. Recall the definition of the sensing threshold is the least sensitive setting at which the pacemaker can detect a heartbeat. The sensitivity setting allows you to control the pacing mode between synchronous or demand pacing and asynchronous pacing, also referred to as AOO, VOO. Notice the range on the sensitivity dial goes from the most sensitive setting of 0.4 millivolts to a setting labeled async. When set to async, the sensitivity is set to a value so high that no underlying intrinsic signal can be detected. Therefore, to pace asynchronously, set the sensitivity dial to async. To pace VVI or AAI, the sensitivity setting must be set so the device detects the underlying rhythm. Set the rate to at least 10 ppm under the patient's intrinsic rate. So in this example, we will set the rate to 40 ppm. To reduce the risk of competitive pacing, decrease the output to the minimum value of 0.1 milliamp. Plug the pacing cable into the socket located on the connector block on top of the temporary pacemaker. Verify that the cable end clicks when it is inserted into the temporary pacemaker connection. The audible click signifies that the plug is completely inserted into the receptacle. Note the sense indicator is flashing, which means the device is detecting the R wave. In other words, the R wave is at least 2 millivolts. Monitor the patient's ECG to ensure the sense indicator matches the device lights. Slowly turn the sensitivity dial clockwise, which increases the millivolt value, until the sense indicator stops flashing. The pace indicator flashes continuously, but capture is not likely because the output value is set to the minimum. Next, increase the sensitivity by slowly turning the dial counterclockwise, which decreases the millivolt value until the sense indicator starts flashing. The pace indicator then stops flashing. This is the ventricular sensing threshold. Set the sensitivity dial to half or less of the threshold value. This setting provides at least a 2 to 1 safety margin for sensing. The same process can be completed for an atrial sensing threshold, assuming that the pacing lead or wire is in the atrium.
How to check the stimulation threshold? Sensing threshold is the minimum atrial or ventricular intracardiac signal amplitude required to inhibit or trigger a demand pacemaker, expressed in millivolts. Before determining the stimulation threshold, make sure the pacemaker is in demand mode. Then set the pacemaker rate 10 beats above the patient's own heart rate, or as high as needed to see 100% capture. A pacer spike with every beat. Next, slowly turn down the milliampere until 1:1 capture is lost. The EKG or telemetry strip will show spikes without complexes following them. Slowly turn up the milliampere until capture is regained. This is the stimulation threshold. The milliampere should be set 2 to 3 times higher than the stimulation threshold. Determining atrial or ventricular stimulation thresholds. To determine atrial or ventricular stimulation thresholds, perform these steps. 1. Verify that the patient is connected to the temporary pacemaker and is being monitored on the ECG. 3. Decrease output. Slowly turn the output dial counterclockwise until the ECG shows loss of capture. The pace and sense indicators flash intermittently. 4. Increase output. Slowly turn the output dial clockwise until ECG shows consistent capture. The following occurs. The pace indicator flashes continuously. The sense indicator stops flashing. This value is the stimulation threshold. 5. Set output to a value at least 2 to 3 times greater than the stimulation threshold value. This setting provides at least a 2:1 safety margin. 6. Restore rate to the previous value. Delivering the beats. Sensing refers to the ability of the pacemaker to detect the heart's own electrical activity and deliver paced beats only when needed. To determine if the pacemaker is sensing properly, set the rate 10 beats below the patient's inherent rate. Note, this step is contraindicated if a patient has no intrinsic rate or has symptomatic bradycardia. Reduce the milliampere to its lowest level, threshold. Then, turn the sensitivity dial counterclockwise toward a higher numerical setting. The sensing light, which flashes when sensing will stop. The pacemaker is now less sensitive to the patient's heartbeat. Now, turn the sensitivity dial clockwise down until the sensing light starts flashing again. This is the sensitivity threshold. Set the sensitivity, measured in millivolts, at half the sensitivity threshold value obtained. If the sensitivity threshold is 4, you will set the dial on 2 millivolts. Restore the milliampere and rate to their proper settings.
The sensing threshold test should be performed first. Once the device is connected to the patient, verify you have proper sensing by checking the cardiac monitor and the device. Now we are ready to perform a ventricular threshold test. This patient has an underlying rhythm. Remember, throughout this testing, you'll want to watch the ECG monitor and the device. First, increase the rate to at least 10 paces per minute above the patient's intrinsic rate. Next, turn the output to 10 milliamps. Verify that you see a rhythm consistent with pacing on the cardiac monitor, as well as the pace indicator on the device. Slowly decrease the milliamps by turning the output dial counterclockwise until the ECG shows loss of capture. Watch the pace and sense indicators to see if the device is sensing and pacing consistent with the ECG monitor. Next, slowly increase the milliamps until the ECG shows consistent capture. The pace indicator will flash continuously and the sense indicator will stop flashing. This is the stimulation or pacing threshold. Set the pacing output to a value at least 2 to 3 times greater than the pacing threshold value. Since the threshold is 1 milliamp, set the output at 2 to 3 milliamps.
Thank you for watching. Press subscribe and share to support my channel. Press the bell button to be notified with my upcoming videos. Thank you.